Clinical procedure for polycarbonate temporary crowns and acrylic temporary crowns is the same. First, selection of the most suitable size and shade of the temporary crown and cutting its margin according to the finish line of the prepared tooth. As you can see here, selection of the suitable size, then we cut off the margins to accommodate the height of the tooth, and the margins should not impinge on the gingiva but be slightly below it. Then seat the temporary crown on the tooth. If it rocks on the tooth, it can be relined with a resin material to improve its fitness. As you can see here, place temporary acrylic material and then seat it inside the patient's mouth. To prevent harm of the exothermic reaction on the pulp, the crown should be removed a couple of times and placed back again until reaching the initial polymerization, then placing it in a container of water until reaching the final polymerization, after which the margins and excess material is removed and polished, and the crown is seated on the tooth. The clinical procedure for the celluloid crown forms is very much similar to the other plastic crowns. First, we select a celluloid crown which matches the form, the height, and the width of the prepared tooth. We puncture the tooth with 2 punctures at the incisal edge at the corners. Then we place an acrylic material or light cure composite resin. The shade should match the adjacent teeth. Then we place it on the prepared tooth. The 2 holes will allow the excess material to be drifted outside from the holes rather than going deep under the gingiva. And finally, after curing, the celluloid acetate crown is removed and polishing is done, and any excess material is removed, and we have a temporary crown. The second type of temporary crowns is the custom-made temporary crown. Methods of construction of customized temporary restorations. There are 3 types. First, direct method. Second, indirect method. And finally, the indirect direct method. The first one, the direct method, in it, we take a pre-operative impression, meaning an impression before preparation of the teeth. Then we finish the preparation of the teeth. We take a final impression, which is a post-operative impression, pour it with stone, then send it to the lab to construct the final bridge. This is then sent back to the clinic where it is cemented inside the patient's mouth. But the patient cannot be left without any temporary restoration during the time of constructing the final restoration. Therefore, we construct the temporary restoration, which is done by we return back to the preoperative impression, load the preoperative impression with acrylic temporary material at the areas of the teeth that were prepared, then seat the impression inside the patient's mouth on the prepared teeth. Here, the acrylic material will substitute the parts of the tooth that were removed during preparation. Here, after removal of the impression after set of the material, the acrylic temporary material, you could see that it needs slight finishing. So we remove the temporary bridge. In the clinic, we do finishing to the temporary bridge, then cement it back inside the patient's mouth. By that, the patient will have a temporary restoration at the end of the dental visit. The second method of constructing a customized temporary restoration is the indirect method. Here, we also take a pre-operative impression. Then, we complete the preparation of the accused teeth. After that, we take 2 post-operative impressions. The first post-operative impression, we pour it with quick setting stone to form the temporary restoration on this cast before the end of the dental visit. The second post-operative impression, we pour it with normal setting stone and send it to the lab for the construction of the final restoration. Now, how do we do the indirect customized restoration? Is by returning to the preoperative impression that we took. We load the acrylic temporary material inside the preoperative impression. Then we seat the impression on the master cast, which was poured with quick setting stone. After set of the acrylic material, the impression is removed, the bridge is finished inside the dental clinic and inserted inside the patient's mouth before the end of the dental visit. The difference between the direct and the indirect method is that in the direct method, we seated the tray with the acrylic temporary material inside the patient's mouth, while in the direct method, we seat it on the master cast, which is poured out of quick setting stone. The advantages of the indirect method are no heat or monomer on the teeth because the temporary acrylic bridge fully polymerizes on the cast, not inside the patient's mouth. B. Better marginal fitness. This is because on the cast, the bridge can be finished and polished a lot better than when inside the patient's mouth. Finally, less chairside time. The third method is the indirect direct method, in which we take a pre-operative impression and pour it with stone to achieve a stone cast. Then we have to make a celluloid acetate imprint of the cast. This is done by placing the cast under the celluloid acetate foam, which is heated by this device, then pushing the celluloid acetate foam onto the cast with vacuum to ensure that the celluloid acetate will fit exactly on the cast. Then, the teeth that we want to prepare inside the patient's mouth are prepared onto the cast with initial preparation, mild preparation. Then, the celluloid acetate foam is loaded with the temporary acrylic material and then is placed onto the cast so that the acrylic will substitute the part of the cast that has been prepared. Then we'll get a temporary bridge. This is the end of the indirect phase of this method. The direct phase is that we bring the bridge, we prepare the teeth inside the patient's mouth, and try to place the bridge on top of them. But the bridge will not seat from the first trial. So we have to remove parts of the bridge and adjust it so it could sit on the prepared teeth. If the bridge was rocking on the teeth are coated with a layer of Vaseline. The bridge then is loaded with temporary acrylic material and placed on the teeth. After setting of the material, the excess material is removed, the bridge is finished and polished and then cemented inside the patient's mouth. In case we have a missing tooth and we want to make a bridge from the second premolar, first molar, and second molar. Here, the missing tooth would be the first molar. So, we place a prosthetic tooth to match the missing tooth. We form the celluloid acetate template. We prepare the adjacent teeth, initial preparation, on the cast. If we place the celluloid acetate foam, you could see there's space substituting the missing part of the preparation and the missing tooth. This is loaded with temporary acrylic material, and the final result would be a bridge, temporary acrylic bridge, substituting the missing tooth and the prepared teeth. The indirect direct approach advantages are: chairside time is reduced because most of the procedures are completed before the patient's visit. Second, less heat is generated in the mouth. The volume of the resin used during lining is comparatively small. So, the indications of customized temporary restorations are: number one, coverage of multiple individual crown preparations, so it is a lot easier to prepare temporary crowns with one impression rather than use a lot of temporary crowns. Number 2, coverage of a single tooth preparation, which is usually large or of a special design. Sometimes we have long teeth or teeth with certain anatomy that we can't find any prefabricated form that fits this tooth. So, in such a case, the customized temporary restoration is indicated. And finally, abutment preparations for fixed partial dentures to construct a temporary bridge. Thank you.